Thank you for staying with us. This is Carol Parisi for Champion News Talk Radio with Truth About Obamacare specialist C. Stephen Tucker and Jack Roeser and we are talking during the break about IPAB. What is IPAB?
The Independent Payment Advisory Board. This is a board that is currently being staffed as we speak, right now, with unelected bureaucrats and the decisions that it will make regarding cutting benefits for Medicare. For the first time in U.S. history, an unelected board will be able to cut Medicare.
But that's cutting spending. Isn't that a good thing?
Cutting service.
Cutting service.
Oh.
Here's the problem. Whatever decisions they make, the federal government can only overturn those decisions with a super majority in Congress, which means that this board is able to make these decisions arbitrarily without the voice of we the people, and the decisions they can't make cannot be overturned, because try to get a supermajority in Congress on anything, it's not going to happen. So that's the biggest thing that worries me. Added to that is this lie about the fact that people could not get medical care. Jack's going to list off a few ways that you can get medical care without needing Obamacare, but it's also health insurance. The reason we have pre-existing conditions in this country is because of Congress. It is not because of the health insurance companies. In 1996, they passed a piece of legislation called HIPAA law. And in HIPAA law is a section called portability. And it states that if you have health insurance and you've maintained that health insurance for 18 months and you move to a new employer-sponsored group health insurance plan only, you have no lapse of more than 63 days, that new group health insurance plan must cover all of your pre-existing conditions.
Is COBRA part of that
COBRA also applies. If you lose
Okay.
an employer-sponsored health insurance plan, you have more than 20 employees that you employed, you must be able to continue that coverage for 18 months. What did not happen when they wrote that legislation is that no portability protection was provided for individual policyholders. The backbone of this country, people who are small business owners that don't have enough numbers to actually negotiate with the insurance company on a group basis. They gave them no protection for pre-existing conditions. So when they dropped the ball on the federal level, our state stepped up and opened what's called high-risk health insurance pools. In Illinois, it's called the Illinois Comprehensive Health Insurance Plan, or ICHIP. And it is a place that people could go today and could go 16 years before Obamacare and not just get medical care, but health insurance for their pre-existing conditions.
You're a fountain of information on this, and really it takes a lot of dilution for people to catch on to the very important things that you're saying. There's a mountain of inappropriate things that have been done by the government to make a really awful thing out of health care.
Yes.
I mean, who among us really wants a bureaucrat to decide what kind of care we get? But it all started with a big lie by the President of the United States when he proposed Obamacare. And I now spell that care with a K. There's implications there. But the big lie that this thing all started with was that without the government, people weren't going to get medical care. But at that time, I wrote, and I've got it right in front of me now, I got 18 different ways that you can get medical care without the government. It gets as far out as the family takes care of its own. Woo! That's what we did before World War II.
Concept.
Nobody had insurance or the government, excepting the soldiers. But it's from that. There's all kinds of ways that you could get things. But let's just do some practical stuff. Comprehensive insurance at the place you work, private or public employment. Get a job. You got to care. That's not the government doing it. Another thing, right now, you can go to the county hospital. I don't care who you are, where you are, you're going to get care. The president has lied.
Yep.
You can go to charitable hospitals. The law says that if you're a nonprofit organization, you must provide medical care for the indigent. I've got 18 of these things, and some of them really get down to, say, holistic care. There's a bunch of people who are damn careful about how they live, so they don't need so much medical care, and I don't know why they should carry everybody else's burden.
And you mentioned...
But the fact is, your president started this out with a stinking lie about why what you've got in America is the most charitable bunch of people anywhere.
Amen.
Whether you're drunk or improvident or just sick without your own cause. There are people everywhere around you that will step up and as an American will help you.
Amen.
And certainly prime among all of that is your own family. Keep your snoot clean and your family will take care of you. And that's how you instill morality along with practical care
Well, it's
in life.
personal
Well,
responsibility.
it's costly.
Your government, your president lied to you about the necessity of this farce that he's foisted off on us.
There's costly redundancies. It's no different than contraception and mammograms. Oh, we need to look out for the women, and so we've got this new thing that's requiring health insurance companies. Why are we giving Planned Parenthood all this money to conduct mammograms and provide contraceptives for free? We're already doing it.
And let me just change the narrative for the GOP, which is very bad on messaging. The left wants to say that this is a contraception mandate and that it's the GOP war on women.
It's a war on women, yes. I feel like I'm at war now.
Let me change that. It is actually the left's war on religious liberty, religious freedom. In that preventative care mandate, which was an interim final ruling passed August 1st, 2011, HHS listed you have to provide all of this preventative care, including contraception. In their minds, in that legislation, preventative care includes abortion.
Yes.
Includes abortion. And as of 2014, every American in this country, regardless of where you stand on abortion, $1 of every premium you pay to any health insurance company inside or outside of the Obamacare exchanges will be spent on funding abortion. And this president promised us that it would not happen.
Well, he's made a lot of promises.
Thus, the State of the Union address, you lie!
You lie.
God bless Joe Wilson.
Yes, yes. You know what? We are going to come back after the break, and we want to hear some solutions.